Good evening. Now, this evening I'll be talking about 5 medications that can be administered by the EMT. I'll also be talking about their indications, contraindications, side effects, routes of administration, and dosages. Now, the first medication that I'll be talking about is aspirin. And aspirin is indicated for a person who's having chest pain associated with myocardial infarction, mild head pain, headache, as well as muscle ache. Now, aspirin is contraindicated for someone who might have had recent bleeding or a hypersensitivity to aspirin. Right? Now, the side effects of aspirin are stomach pain, nausea, vomiting, as well as an allergic reaction to aspirin. Now, aspirin is administered orally, right? And the dosages for aspirin are 160 to 325 milligrams of chewable tablets. Now, the next medication that I'll be talking about is nitroglycerin. And nitroglycerin is indicated for someone who's having chest pain associated with angina or myocardial infarction. Now, nitroglycerin is contraindicated for someone who has recently or has taken erectile dysfunction drug in the past 24 hours, such as Viagra or Cialis. It is also contraindicated for someone with head injury as well as hypotension. Now, the side effects of nitroglycerin are hypertension, headache, nausea, as well as burning under the tongue. And nitroglycerin is administered sublingually. And the dosages for nitroglycerin are 0.3 to 0.4 milligrams of the tablet sublingually or 0.4 milligrams of the spray sublingually. Now, the next medication is EpiPen or epinephrine. Now, the EpiPen is indicated for someone who is having a severe allergic reaction. Right? It is contraindicated for someone who is having chest pain associated with myocardial infarction. It is also contraindicated for someone who is having hypertension and hypothermia. Now, the side effects of EpiPen or epinephrine are hypertension, tachycardia, anxiety, and restlessness. Now, the EpiPen is administered intramuscularly, and the dosage for the EpiPen is 1 auto-injector. And the next medication that I'll be covering is oral glucose. And oral glucose is indicated for someone who is having low blood sugar. It is contraindicated for someone who has altered mentation, nausea, as well as vomiting. Now, the side effects of oral glucose are nausea and vomiting. And oral glucose is administered orally into the mucous membrane, right? And the dosages for oral glucose are half to 1 tube of oral glucose. Now, the next medication that I'll be covering is oxygen. And oxygen is indicated for someone who's having hypoxia or suspected hypoxia. Oxygen may be contraindicated for your COPD patients because it causes a decrease in respiratory effort. It could also be contraindicated for someone who is having ischemic stroke or acute coronary syndrome because it is a vasoconstrictor. Now, the side effect of oxygen, which is rare, is a decrease in respiratory effort for the COPD patient. And oxygen is administered via inhalation. Now the dosage or dosages for oxygen is dependent on the patient's need at that particular time and based on the device used to deliver the oxygen. Now oxygen can be delivered in a concentration of 28 up to 100% inspired oxygen. Thank you.